Hello, and thank you for joining me today. My name is Nathan Feiles. I'm a psychotherapist in New York City. I'm also a coach in New York City, and I, um, I'm here today to talk with you about panic attacks. So just before we get into that, I'll tell you a little bit about my work and uh, where I come from in my practice. I specialize in really many different forms of anxiety. So anxieties can come down to general anxiety, which I'm sure many here are aware of. There are also phobias and things like fear of flying, which is another specialty of mine. And there are also things like social anxieties, and all different forms of anxieties are a specialty of mine. So I'm here today to focus on panic attacks and the experience of panic attacks. And if you'd like to see more about what I do, you can always take a look at my website. It's there on probably on your screen in front of you. But let's just start right in. So, as I said, we're going to talk about panic attacks, and really the hope for this presentation is that you'll come away having a better understanding of how panic attacks can present in the mind and the body, the reasons that panic attacks can happen, and also understanding kind of the best direction to look for in terms of options for treatment. So just to kind of give some expectations of what to expect to come out of this presentation. While it's not going to likely leave you feeling cured of panic attacks or anxiety, which would be nice if we could do that, but realistically, hopefully this will at least give you a better understanding of what's going on in these moments for you, where your body and your mind seem to have kind of run off into their own space without you. And really to just help point you in a better direction of how to start listening to your mind and your body and how to get the most appropriate help for you. So, panic attacks. How do they present? And I'll start by saying that panic attacks are not the same for everybody. They're a very individual event. They don't really show up the same for each person. Some can feel them in their mind, some can feel them in their body. And it's really just a very different experience from one person to the next. You may be well aware of this kind of stereotypical, almost cliched panic attack where it feels like you're not sure if you're having a heart attack and you feel this tightness in your chest, you feel like you can't breathe, and the first instinct is to want to call 911 or go to the hospital. And that's definitely a very real form of panic attack. But this isn't the only way that panic presents. So just to understand up front that even if panic attacks really manifest one way for you, it's not necessarily going to be the same for the person next to you who might struggle with their own version of panic attacks. So anxiety can flood the mind and body in very different ways during a panic attack. And sometimes these attacks are really a whole body event, but it isn't always necessarily that way. Some may really experience the physiological symptoms of panic much more. And when the physiological symptoms show up, the body anxiety can really go onto overdrive. You may feel like there's a whole lot more energy kind of ravaging your body, kind of just flying through your body more than your body can handle, kind of a feeling. You might also hyperventilate, which can really feel like an experience of struggling to breathe. Even though you're able to breathe okay and you're getting enough oxygen, you might be getting too much oxygen. You might start to feel dizzy, lightheaded. So these are some ways, as well as you could have rapid heart rates, you can get pain and constriction in certain parts of the body, which is obviously really unsettling, especially if you're feeling it in your chest or in certain other places in your body that might feel like there's something urgently wrong. Also, sometimes the mental part of anxiety and of panic can really stand out more than the physiological for people. People who struggle with more mental forms of panic can really get into places where they can become deeply obsessive with thoughts and can become very fearful or ruminating, or catastrophic thoughts start to take over, like something really bad is just about to happen. And these are kind of the separate mind and body experiences. They're also, with panic, another way that panic attacks can manifest is an overwhelm of the senses as a whole. So the senses can actually become very pronounced and overly sensitive in these moments of panic. For example, you could really experience a sense of tunnel vision where everything just kind of drops out around you and you're kind of just hyper focused into one area. Or you might even experience some tunnel vision where you can't quite experience a focus of anything, where you're just kind of in this tunnel and you can't really get a good sense of focus. So, but just in that space where things kind of drop out around you and you're in this narrow space. Also, with senses, sound can become very far away or highly sensitive, or almost the smallest sound kind of rings around in your head, maybe even creating kind of a tinnitus sort of sensation, or almost a sense of dizziness, like you're overwhelmed with the amount of sound, can be very sensitive there. Touch can also be very sensitive when you panic. And it could be just the sensation of not wanting anybody to touch you at all, that any sort of contact can make you feel like you want to jump out of your skin. And even feeling sort of out of your own body. These are just ways that senses within your body can also become heightened. And panic attacks, they really can be triggered with little to no reason at times. And sometimes they can have very obvious reasons, which we'll get into more in a couple of minutes. But aside from these very obvious sort of mind, body, and sense overwhelm that you might experience with a panic attack, there's also the freeze and the shutdown sort of state. So it's not just the fight or flight, but there's also that freeze that can happen with panic, where you feel like you can't move, you feel like you can't think straight, that you might become really confused and not be able to make sense of anything going on around you, might even feel a bit catatonic. So it's not just the fight or flight that you can experience with a panic attack, but also that freeze can be also another way that panic really manifests and shows up within you. So now, to bring this together just a little bit more, the mind-body connection is usually, it's not always, but it's usually a very significant part of panic attacks. That the physiological or the mental can actually grab onto the other and start to run away with it. So if you start to feel in your body this sense of tension, the sense of overwhelm, your stomach is starting to hurt, or you're hyperventilating, or you might be crying in a panic attack, all of these different sensations can, once they start and hit this threshold where your body just becomes overwhelmed, they can start their own sort of cascade and snowball into your mind, where then your mind starts to wonder, oh, I'm feeling very out of control here. I don't know what's going on. I know that I'm overwhelmed and I know that something's wrong. And that's generally the feeling when that physiological sort of event starts to show up. So when that happens, though, the mind can start to follow it and start to think something is wrong. What's the catastrophic event that's happening here? Something really bad is about to happen. And then your mind can start to ruminate on what's showing up in your body. And then you have everything just sort of all going at once until it feels like you have no control at all over the whole situation. It can also go the other way as well. If you're really ruminating or in an obsessive kind of hyper-focused racing thoughts sort of place with high mental anxiety in a moment, what can actually happen is the stress from that moment can start to manifest in your body as well. So if you're incredibly mentally stressed, you might start to notice that you feel more tension in your body. And at some point, that tension can turn into a physical stress, like a pain in your stomach, or maybe even depending on how you're holding that tension, a pain in your leg or something that might start to really grab on to the physiological more. So the mental stress and the mental panic can actually start to signal the body and take it with it. So then once again, one way or the other, you've been pulled into this overall body event, this mind body sort of event that can feel really out of control and feel really scary when it feels like you have no sense of what's going on. And it feels like your body and your mind, they've really run away without you in these moments. So that's just kind of a sense of how the mind and body really can feed off of each other during a panic attack. So let's go into more of a sense of how panic attacks can be triggered. And it's not just one way. There are actually several different ways that people can find themselves in a panic attack, suddenly or even over time. So again, these trigger environments, they're very personal. And for each person, they might be more, each person might be more prone to one trigger environment than another. So you can experience more than one of these sort of trigger environments, but it's also possible that for you've maybe experienced one on a regular basis and someone else might experience another. So just kind of a sense of that. But so one trigger environment is situations with emotional overwhelm and fear that's just happening in the situation. So worries of imminent catastrophe, the feeling that you're in a space right now where something really bad is about to happen to you. And, for example, this can be something like you're walking down the street and it seems like somebody's following you, or getting onto an airplane might be something that causes panic for you if you're flying, getting into an elevator possibly, having an exam that you need to take, meeting with the boss, or a worry about being fired, losing your job, or just a general feeling that you're about to be in some sort of trouble. And any sense that something's about to happen to you imminently. So it's not just a general sort of anxiety where you're just having kind of a lot of anxiety right now, but one situation is the sense that you're in an environment where everything is about to fall apart on you, and that in and of itself can create the environment for a panic attack. Another situation is an anxiety overload, but this is not the same as that worry of imminent catastrophe, as I was just talking about a minute ago. But this is more of a slower buildup of emotions like anxiety or anger or other emotions that tend to kind of store themselves within your body, which can very much happen with emotion. And the thing about this is that you may not necessarily feel the sort of anxiety overload, so to speak, that you might not feel this kind of panic attack coming on. That if you're someone who can be really good at pushing away or blocking emotions that you don't want to have to deal with or experience, and often this happens unconsciously. This isn't always something that you might try to do, but you might just be good at sort of blocking out certain emotions that are a little more intolerable or tougher to deal with. And when you're kind of pushing aside those emotions, they can start to bottle, just like bottling anger can happen, where somebody kind of pushes away that anger and then over time it starts to build up and then suddenly they're exploding with anger. So it's kind of like that, where there's sort of a threshold and there's a baseline for anxiety. And over time, that bar of anxiety starts to rise up and up as more anxiety or other sorts of high energy emotions get stored into your body until that bar is kind of raised to a point that you can no longer block out the emotion anymore. And it hits that threshold, and suddenly you realize that all this emotion is just flying through your body and your mind is starting to go with it too, and it completely takes you over. And that's sort of the anxiety overload panic attack, where you may or may not experience that anxiety is increasing, but then you hit that threshold and this event just kind of starts, and it feels at that point like you've lost complete control over it. And another part of this is some people generally have a high baseline for anxiety and fear, so that can kind of put you at a regular sort of threat for a panic attack. Because if you're already kind of existing in a high anxiety place, whether you know it or not, it might just be something you're so used to being in that you may not actually realize that you're in a high anxiety state, even if you're regularly in that space. So if you're continuously existing close to that threshold for panic, it may not take that much to actually push you over that line to where the panic attack's starting. This might go for those of you out there who seem to have a panic attack on a fairly frequent basis, that there might be something that's operating consistently at that high baseline level where you're not too far off from panic at any moment, really. So going into the next one, and this one is kind of a more difficult one in some ways for people to deal with. Not that any one of these is better or worse, but there's also the trauma response panic attack. And with this one, this is more of a present moment, something in the present moment that's recalling an older, more previous trauma or some previous highly anxiety-inducing experience. And the panic attacks in these situations can very much be a trauma response. So it doesn't necessarily have to stem from a high baseline of anxiety or even a creeping up sort of bar of anxiety that I was just talking about. Something in that particular situation, something that can mimic a part of a traumatic experience, or something that just causes a deeper, kind of more unconscious emotional recollection of something traumatic or something that was just highly anxiety provoking in the in the moment. You may be emotionally reconnecting to this point in time internally, even if the situation itself is actually different. So for example, let's say that you had a traumatic event in the past, and now in the present, you are somewhere and you smell a scent that just somewhere in your mind, you may not even recognize this consciously. You may not say, wow, this reminds me of that time. But your body, the moment you smell this, whatever it is that just makes its way to your senses, your body suddenly just starts to react. And you suddenly might feel terrified, like you can't move, or that suddenly your mind has gone in a completely different direction. But the reaction just starts without really any warning. And with the trauma response panic attack, this can very much happen where something that seems very small or something you might not even consciously recognize just makes its way to you and recalls something stored in your body or in your mind that starts to trigger the attack right away. Now, the thing about stored anxiety and stored emotions can actually be quite relevant with panic attacks, because when I talk about physiological anxiety or even the more mental anxiety, either way you go with it, things get stored up. Things get stored up mentally, things get stored emotionally. And when there's the right trigger for these emotions or for the thoughts to start swirling and to start coming out, it can be very hard to control that. So I'm going to go now into more a sense of the role that that control seeking that can play in panic attacks. So, and I'll explain more what I mean by control seeking. But when trying to keep control over negative emotions, for example, just such as sadness or anxiety or fear or anger, people can actually bring themselves closer to that threshold of an emotional overload. Now, there's a sense that keeping control and keeping it together can be the way to go. That's what they need to do. You got to keep control of the emotion and keep it together. And some people very much feel that that's the level they have to operate on. However, at a certain point, what ends up happening is you just end up bottling these emotions and dissociating these negative emotions until they can't be stored any further and they just start to spill over. People at times, when we're working in therapy, people will say things similar to, I used to be able to put the emotions to the side, but now I can't really do it anymore the way that I used to. Or there was a point where controlling more and more could work, but once things built too much, I just couldn't really control the feelings anymore. They would just find their way through, and they would all just kind of fall apart. So people, they tend to try to keep control, but there's a certain point where trying to control the emotions too much can actually cause more and more stress in that sense, where you're building closer to that threshold of panic. And actually, I see this a lot with people who come to me to work for fear of flying. And while fear of flying is very complex in its own way, separate from just panic attacks itself, the desire that people will often express at the beginning of our work is for me to kind of give them ways to have more control, that they want to have more control over the emotions. And while there can be some room for this, with respect to, having room to have some coping skills to help in the moment, to, not be so overwhelmed with emotion, the reality is that learning how to tolerate and be okay to not have control and the ability to let go a little bit emotionally is actually quite an important part of lowering that bar of anxiety. That bar that's creeping closer and closer to panic. Really, as you try to control emotion more and more, that bar keeps going up. That as you can become a little more vulnerable or let go and allow the emotions to be around more and experience and learn how to be with that, that actually is what helps, one of the ways that helps to lower that bar away from the threshold. So vulnerability is really an important piece of this dynamic with control. People who strive to constantly be in control can often be more susceptible to struggles with emotional vulnerability. And this can show up in various ways, whether it's worry of being embarrassed or humiliated, or appearing visually to be out of control in some ways, or worrying about being judged in other ways. Kind of the worry that people will see them panicking or losing control and not having it all together, or emotionally being vulnerable to other people, which can happen in relationships. But just the same as learning to be vulnerable can release that pressure valve on anxiety, but the more control one tries to keep, the more tension and anxiety is often actually the result of that. And some might wonder, as I'm saying this, possibly, what's wrong with controlling emotions? Isn't it good to have control over your emotions? And yes, obviously, being in control of yourself and having a sense of the difference between healthy acting out versus unhealthy acting out versus a healthy experience of emotions, I should say. And knowing how to behaviorally respond to certain feelings, it's a good thing. And it's an important thing to know how to sort of manage emotions in that sense. But that's not the same thing as trying on some level to actually keep yourself from experiencing vulnerable emotions. There's a difference between those two things, between being in control of emotions in a healthy way and kicking out emotions that feel just too threatening to experience at all. So the point in this dynamic is that the need to over control emotions out of fear of panic can actually contribute to becoming closer to the panic attack and actually creating even more severe panic attacks at times. So the more you're feeling the need to keep it all together and therefore having less vulnerability, the higher the baseline of anxiety tends to already be in those situations. So as more control is attempted to steer emotions away, and kind of push the emotions to the side, like I was just talking about, that room for error becomes more and more narrow until it feels like you have no more room for error at all anymore, that any little thing you do is going to make you feel like you're about to break down emotionally, or that you're about to lose complete control of your emotions. So there gets to that point where there's just no more room at all for error. So allowing space to be vulnerable and not always having to be in control, it is one important part of reducing anxiety and panic and fear in general. And obviously, look, this is much more easily said than done. This is something that people tend to work on over time in therapy, to be able to kind of let go and have the vulnerability be more tolerable in these ways. But letting go and having room to breathe and not having things always be in your grasp, it can really be quite a liberating thing. So let's talk a little bit now about treatment and, well, what are the best ways to really approach treating panic attacks. And there have been a lot of conversations over time about, what's the better way to go. Is it better to do more of the traditional talk therapy, which is more the psychodynamic, psychoanalytic types of therapy, or is it behavioral therapies like cognitive behavioral therapy, for example? And when it comes to treating panic attacks, I really find that a combination approach really works best overall. Now, while sometimes people could be inclined to believe that concrete exercises and cognitive behavioral therapy may be a good thing for relieving panic attacks, behavioral exercises really actually plays a smaller, more short-term role in helping through panic attacks generally. Certain types of exercises, they really can be helpful for coping in the moment, where you're kind of closing in on the panic threshold and trying to kind of back away and slow down that emotional system a little bit. So it's certainly not a bad thing to have coping mechanisms and just some things in your toolbox there. But for some, once this threshold is reached, though, it sets off a mechanism with the panic attack that really has to almost run its course before calming down for some people. Some are able to kind of recognize the panic attack and slow it down a little bit. For some people, it feels like it almost has to run through and burn out the panic and anxiety before it calms itself down. So some can apply these exercises to take the edge off and somewhat reground themselves in these moments. But for some, once that threshold is reached, it can be really hard to apply the behavioral techniques and have them effectively work once the panic has set in. So what I found is that when it comes to working with panic attacks, that the underlying work really tends to, overall, longer term, be much more important in that sense. That when it comes to panic attacks, really working through the psychological, emotional, and relational factors that are setting the stage for these attacks with psychotherapy is really the most important part. Is that's what starts to restructure and kind of lower that anxiety baseline, but also it changes how you respond to things in your life that in the past might have created more anxiety, or if there's a trauma that's causing these panic attacks, that you can work through, that whatever's going on underneath, or whatever's being held and stored in your body, or whatever's happening unconsciously that really sets you up for these panic attacks, that's where the kind of the real psychotherapy work can start to work you away from that. So you're not constantly sitting really right next to the threshold and waiting for the panic attack to happen again the next time. So even if you can cope in a moment with some behavioral exercises, it doesn't necessarily stop the panic attacks from coming back. And that's one thing that's really important to note. And while it's still good to have these exercises, it's really the longer term wanting to not constantly having to be staving them off. That's really kind of the goal. So one thing I'll say, aside from just, which kind of therapy, which again, I will say is a combination, mind-body work can really be very effective in working with anxiety, with trauma, with fear, especially things that can be triggered to experience in your body, like panic attacks and fears that can manifest through your body in different ways. And mind body work can always be done in conjunction with deeper talk therapy or behavioral therapy, and these can be very effective at starting to kind of clear out that emotional storage tank. And one of the things I use is focusing, which is a way to help the body release stored emotions while also helping you learn to reground and your body learn to reground itself in the process. But there are several types of different somatic therapies out there that can be done in conjunction with dynamic therapy, behavioral therapy as well. So this will kind of take us to the end of the presentation. I know that some of this might have been a bit confusing. I know there's a lot of information that I just kind of threw here into this half hour, but don't feel like you have to take everything that I said, um, with you out of this. Just to kind of have a sense of listening to yourself, and that's kind of where I would like to leave us off here today. And at our presentation with this is that it can be really easy to experience a panic attack as something that's kind of infiltrating your body and your mind, and that the feeling is that you need to throw it out of your system as fast as you can before it takes you over and destroys you or makes you kind of collapse in some sense. And of course, that's an understandable feeling. It's a kind of terrifying feeling to have when you're so out of control of your body in these moments and of your emotions. And what I will say, though, is for the purposes of just thinking, and approaching panic attacks differently, see if you can actually think of your panic attacks as almost your mind and your body trying to give you some sort of message. Instead of trying to kick it out as fast as you can, almost that you can listen to it in a different way, that your mind and your body is reacting to something. You may not know what that something is, but that you know that it's reacting to something for a reason, and even if you're not sure what it is yet. And rather than trying to get it away from you as fast as possible, maybe think about what it would be like to actually just try to pay attention and listen to what you're experiencing, and really try to be open to what your body is trying to communicate to you. And this is something that will probably, in a mind body type of therapy, would be more the approach in terms of just trying to understand what your body's communicating with you. And, with anxiety, it's often actually worsened. Anxiety becomes a lot worse, generally speaking, when you're trying to get rid of it. The more you try to push away anxiety, often people will experience that it exacerbate the anxiety. So this is more of a skill that you can start to develop in a therapy and in a mind-body therapy, where you can actually be open and listen to your body and your emotions more, rather than closing off to it. So this is a form of acceptance, though, with emotional experiences. It can really go a long way with relieving symptoms of panic and anxiety. So I would like to leave us off with that for today. And I thank all of you for joining me here. And you're always welcome to reach out to me. You can see my website there, and my contact information is there if you have questions or if you'd like to be in touch for any reason. But either way, I hope that all of you can find your way. If you're struggling with panic attacks, so you can find your way through it. And I know it's not an easy struggle to go through, but it's certainly something that is possible to overcome. And I wish the best to everybody here. And thanks again for having me today.